All right, so we're going to be talking a little bit about the other pieces of consideration if we are looking at a potential diagnosis of depression or anxiety. Because it's really important to make sure that we're looking at people as a whole and realize that there are other conditions, other influences that someone can be experiencing that can look like depression, but also make treatment of depression more challenging. So if someone has what we call non-organic causes, so it's not from their brain directly, if you will, some of these can be really modifiable, right? So substance use, any sort of a central nervous system depressant, long-term in particular, can actually cause depression. So alcohol and benzodiazepines such as Valium or Klonopin or Xanax, sometimes used for anxiety in particular, over a period of time can actually make it harder to treat depression and can cause symptoms that look like depression as well, which is challenging because a lot of people may consume alcohol as a coping mechanism for their depressive symptoms, and short term can cause euphoria and activate the limbic system, but its CNS depressant activity long term can be problematic. There are other medications that can cause depression-like symptoms, which we'll talk about in the next slide. But we also want to think about medical conditions. And these are conditions that can cause symptoms that are similar to depression, but also, if untreated, can make it more difficult to respond to treatment of depression. So we always want to look at those other psychiatric conditions. But a big one is thyroid. So if someone has low thyroid, they tend to feel more tired, more fatigued, less comfortable. And that can look a lot like depression. People who have anemia, they're not oxygenating well, and they feel worn down. They feel difficulty concentrating. They feel exhausted. Heart disease, other chronic medical conditions, and vitamin deficiencies. So things like vitamin D, for example, folic acid. Deficiencies in those vitamins can sometimes make just people not feel very good. They feel worn out. We knock the wind out of their sails, if you will, and can make it harder to respond to antidepressants, but also can look a little bit like depression as well. So medications that are commonly associated with depression include antihypertensives, so beta blockers, which are sometimes even used for anxiety symptoms, calcium channel blockers, so things that decrease blood pressure, particularly if they decrease heart rate, can make you feel tired. CNS depressants, as I had mentioned before, alcohol, benzodiazepines, opioids, even when used as prescribed. Anti-infectives like fluoroquinolones, so like your Levaquins, for example, your Cipros, acyclovir, which is an antiviral. And then there's some variability here in terms of some of the data, but isotretinoin, which is Accutane, so it's used for acne, oral contraceptives, so anything that messes with hormones can sometimes cause symptoms of depression. And depending on the study that you look at the population, there's a little bit of variability in the data for these, but certainly something to take into consideration, especially if there's a timing, piece to it. So they start this product and then shortly after they experience new onset depression. Corticosteroids. Corticosteroids are literally stress hormone. So they're great for suppressing the immune system. If you have a severe allergic reaction or asthma or inflammation that needs to be addressed, they're so important. They are so important, so useful, but it is cortisol essentially, right? So when you take corticosteroids like prednisone, then it can affect your hypothalamic pituitary adrenal axis and can cause symptoms of a lot of different mental illnesses, including depression. Other medical causes, really anything that is chronic in nature, so diabetes, cardiovascular disease, asthma, COPD, and neurologic disorders. So there's a lot of association with things like fibromyalgia, which is a complex type of pain condition that really, it can be tricky because we don't fully understand it, right? But it can respond to antidepressants. Respiratory disease, I already mentioned, but difficulty breathing is a physical symptom of anxiety in addition to, kind of the brain and the body talking to each other, right? So if we have things that cause physical symptoms similar to anxiety, our brain might go, ooh, is this anxiety? And make you feel more anxious. So it's always really, really important to try to address and treat all these types of conditions as well. We see connections with Ehlers-Danlos syndrome, which is a connective tissue illness that is on a huge spectrum, where there could just be hypermobility, but there could also be a lot of mental health challenges, cardiovascular challenges, so heart challenges as well. We see migraines have an association with anxiety and depression. We see seizures have an association with anxiety and depression. So certainly there is that overlap if you're looking at the same organ. Drugs that induce anxiety. So we talked about depression. Drugs that induce anxiety, we can sometimes see antidepressants actually short-term increase sensation of anxiety as the body adjusts to the effects of the antidepressants, despite antidepressants actually being a good treatment for anxiety. Some antihypertensive, so some blood pressure medicines, anti-seizure medications, again, we're messing with the brain, antimicrobials, so a little similar there. Theophylline, which isn't used very often anymore. It used to be used a lot for like asthma. And it's actually a kind of a caffeine type derivative. Corticosteroids, because that's always the answer. Sympathomimetics. So these are things that increase the heart rate. So albuterol or ProAir, right? The inhalers that you sometimes use for the symptoms of asthma is what we call a beta agonist. So not only does it open up the lungs, but it also interacts with the beta receptors on the heart, which will cause the heart rate to increase. And when your heart starts racing, it can make you feel anxious. Thyroid hormone. So hypothyroidism can make someone feel depressed, but if you have too much thyroid, you get sweaty, you have increased heart rate, you don't feel as hungry, and it can actually mimic anxiety. And then stimulants. So cocaine, methamphetamine are kind of more the illicitly used stimulants, but we will see increases in anxiety for things like our Adderalls or amphetamines. We'll also see it for our methylphenidate products. Anything that increases your blood pressure and your heart rate and that physicality can cause it. Okay, so I'm going to stop here and I'm going to talk about pathophysiology next.